So, we always end the year talking about infections and disease in microorganisms, and this year, obviously, it's exceptionally important. So, before we dive in, let's talk about some vocabulary. So, an infection is the invasion of tissues by something that causes a disease, and then those things multiply, and the tissue responds. So, we can be infected by have a bacterial infection, we can have a viral infection. It's anything that causes disease that initiates a negative response in our tissues. A disease is a condition that impairs normal tissue function. They're not all contagious. So, for example, the guy in the picture was hit with an arrow. That is a disease. Certainly not going to spread from person to person. So, speaking of spreading from person to person, contagious means that something is easily transmitted from one person to another. Virulent is something that can cause disease. So, there are some things that are contagious, but they don't cause that bad of diseases. And some things, of course, are both. A pandemic, which is a word we're hearing about a lot lately, is when a disease spreads over multiple countries and continents. You might have heard of epidemic, that's a local situation. Pandemic is worldwide. So things that can cause disease, before I call it a disease causing agent, an infectious agent, there are two categories. Microbes are things that are living, and they can be anything from bacterial or protists or fungi, even some animals. Conversely, there are things that are not alive that can cause infections too. The most common and obviously the most relevant right now are viruses. So we've done a very basic overview of most of the microbes in our classification unit, but because of their importance this year especially, I want to make sure we know and understand what viruses are. So I'm going to leave it to people who can make far better videos than I can for that.